I feel that most people are very nervous about palliative care. It's an unknown, and it was definitely like that, mainly for Ian and I.
Well, when you're in hospital and they talk about palliative care, you think of the worst, and you think that palliative care is the last end of the straw. But since that, I've found it's totally not, because the care is there to keep you going and give you support.
I didn't know what palliative care was. I thought palliative care was just something for people who were dying. I didn't realise that it was for anybody who's got a terminal illness at any time during the illness.
Having been several, calls to ambulance all hours of the day and night, and then waiting in the wards for 3 hours while you get onto a trolley, to be able to get rid of all that and have people come with the same expertise into your house, where you've got, your toilet you can use and the TV, you can have your own program, and not have somebody dying in the next bed next door to you, to me, is the greatest thing of all.
People don't have to be scared of palliative care, because Ian's a living example of how it's a service that works for the comfort of the patient, even though the disease is incurable. You still need pain control and comfort, and that they do magnificently.
We've been married for 54 years, and we've had a wonderful life together. So when it said for better or for worse, I became a carer.
Caring for a loved one, I think, just comes naturally. You love your partner, you love your mother, you love your father, and at the end of the day, you'll do anything for them. And it's just a natural thing to me that you do what you can with whatever resources you have to make sure they're comfortable and have the best quality of life during a very difficult time.
Once the decision to be a full-time carer was made, then everything that went with it was done unconditionally. It was almost this role reversal of he was totally dependent on me, as I would have been on him when I was a young child.
This is not a burden. I think this is part and parcel of, it's a love situation, And she would do the same thing for me.
It was important to me that I was doing a really good job for Ray. Ray was the person that I cared for most in the world, and I needed to do a really good job for him.
I didn't expect anything, any thanks, anything in return. I just needed to do it for him at one of the most critical times of his life.
It's a journey for both of you, and it requires a lot of self-discipline. If you're going to care well, you have to, it's really what you do inside your head as to how well you cope as a carer. And to do well inside your head means being very informed and getting as much help as you can, and being patient, getting counselling if that's what you need. You need to look after yourself just as much as you need to care for the other person.
Being a carer, you've got a role, and it's happening to you too. It's not just happening, this is not happening just to your loved one, it's actually something that's happening to you and your life as well.
There are lots of things to learn, and learning to compromise when you're looking after someone is very important.
I became a medical expert. Yeah, I knew all the drugs, and again, because he wasn't able to take them orally, and we had to crush medication and know which ones he could have in liquid form and so forth. But you just do it. It's just, that's the easy part.
I hate injections. I absolutely detest them, but I was able to give them, and I never thought that was something that I'd be able to do. So yes, you pick up skills that you never thought you perhaps would have to or need to or want to, and you can do them.
People would say, oh, I couldn't do what you do, Anna. I don't know how you do it 24/7, all the things. I'm not very good with vomit. I'm not very good with urine, faeces, etc. But I think when you're in that situation, you do.
I had to take stock as a wife and a friend because at times I had to do things that took away a little bit of his dignity.
You need people who are treating you to be firm but positive with you, and also smiling and friendly, but which they all were. And for sure, some of the treatment is a little bit personal and embarrassing, but I felt comfortable with them doing it.
I was really mindful of Dad maintaining dignity across all fronts. So as much as physically, humanly possible, I tried to keep him involved.
Here's your hat. You ready to play? You put the power on. It gets very frustrating at times when I think that I can do something, then Chris says, no, you shouldn't do it. But I think, hey, I should be able to do that in my normal life. I would have been able to do it. But when you can't do anything like that and somebody has to do it for you, and you usually lose a little bit of independence on that, and I find that very hard to take.
Be an advocate for who you're caring for, and just step back and step in, and just hope that you're stepping back and stepping in at the right time, because you're just both doing your best, really.